Healthcare aides in Alberta work collaboratively as part of the healthcare team and provide care to vulnerable populations such as the elderly, people with disabilities, and individuals who are acute or chronically ill. HCAs are responsible for providing care within the boundaries of their individual competency and education. The nature of the HCA-patient relationship involves intimate care such as bathing, dressing, and toileting. Such care puts HCAs in strong positions of power, requiring high levels of trust by their patients. In Alberta, health professionals, including physicians and nurses, are regulated under the Health Professions Act. The Health Professions Act establishes some common rules for health professionals, as well as authorizing a regulatory body, also known as a college, to create and enforce rules specific to each health profession. Some rules are made by the college alone. Some rules are made by the college after consulting with the profession and the government. And some rules are made by the college only when first approved by the government. Regulation of the HCA profession is important because as major contributors in the evolving health system, HCAs are being asked to perform increasingly complex procedures such as administering medications or insulin injections. Regulation allows for standardization of training and education, standard competencies, and standards of practice. Regulation works to support public safety, and regulating the profession will create a greater level of confidence in the HCA-patient relationship by providing standardization in professional and ethical care. There are key documents that need to be established to govern a profession, such as bylaws and a code of ethics. This graphic shows the type of documents where these rules are established. The Health Professions Act establishes the regulatory health colleges and sets some common rules that apply to all colleges. The regulation outlines the registration and renewal requirements of a health profession. Bylaws outlines the college's governance, including the composition of council, and defines management matters. Code of Ethics, Standards of Practice establish obligations of the registrant in the practice of their profession, and council policies and program manuals. These further clarify the responsibilities of the registrants of a profession. Colleges also create additional policy documents to guide the application of these rules. These documents provide a college and its registrants with key information to guide the profession. Development of these key documents is a collaborative process completed through consultation with Alberta Health, stakeholders including employers, educators, registrants, other regulated health professions, healthcare consumers, and various other parts of government. These documents are put into force by the council that governs the college. The government gives regulatory colleges in Alberta the authority to govern a profession, and each college governs one or more professions. The job of a college is to protect the public from unsafe practice and hold registrants of the profession accountable for the care they provide to patients. Now that you are aware of the role of a regulatory college, let's begin to look at components of the Health Professions Act. Responsibility to endorse the HPA falls to the Government of Alberta. Some of the areas covered by the HPA include registration, including mandatory registration, identification of protected titles, and professional conduct and the complaints process. The regulation for each profession typically outlines categories of registrants, for example, provisional or general, some registration and permit renewal requirements, and some aspects of scope of practice and continuing competence. Similar legislation will apply to the healthcare aid profession in Alberta once regulated. Development of the regulation is done in collaboration with government, the college, and other relevant stakeholders. It is put into force by the Government of Alberta. The exact date when this will occur is unknown at this time. Many components in regulating the HCA profession have been examined throughout this video. By connecting regulation to HCA practice, this underpins the commitment and integrity required to provide public safety and confidence. More information on the work of the Regulatory College, including governance, registration, continuing competence, and professional conduct, will be outlined in video number 3. Updates on the HCA regulation are available online at hcaregulation.com.